My name is Dr. Alex Kim, and I'm an interventional radiologist. We decided to start MVP largely because of the frustrations that we saw with patients, the patient experience at Georgetown. And I don't think this is unique to Georgetown. I think this is applicable to most large hospitals where the patient oftentimes seems like they're a number. They are one of the 20 people who are waiting to get registered. They're one of the 10 patients in the holding bay waiting to get moved in for their procedure. And we wanted to be able to provide a level of care that was much more personalized to the patient. So when a patient comes into a smaller office setting, such as ours, all of the staff's attention is on that patient for the time that the patient is here. So we don't have the 100 other patients that are coming in through the door. Everyone is focused on your care at that moment, and we're not distracted by anything else. And I think having that level of involvement, being able to provide that level of care to my patients was the main driver to us moving from the hospital setting and opening up MVP. I think there are a lot of things that make MVP unique. I think foremost is just the experience that Dr. Linsky and I bring to our practice. He and I have both have had over 10 years of practice in interventional radiology at a very busy academic center. We were the leaders of that department. So, and we dealt with a lot of different ailments. So we bring our experience to the outpatient setting. The fact that our staff largely have worked with us for the past 5 to 10 years. We have a very close relationship. We understand the needs and demands of the staff that work with us. And I think that helps us to provide better care for our patients. And thirdly, I think we have a space that is state of the art. You come in here, everything's sterile. Our equipment is the latest. We know the latest techniques. So you are getting the cutting edge type of care in an outpatient setting, which I think you wouldn't be able to receive in a lot of other outpatient centers. So I wanted to be a physician for a lot of different reasons. I always had an interest in science. Was always really fascinated by being able to see and treat patients and help patients who are sick. And especially interventional radiology, because we're able to really get immediate effects on patients through such a minimally invasive means. It was a field that I was immediately attracted to. So I am originally from Seattle, Washington. Went to the University of Washington for my undergraduate degree, moved to Philadelphia, and went to Drexel for medical school, and then moved to DC and did my training at Georgetown. I stayed on at Georgetown as an attending physician, and then was the chief of interventional radiology at Georgetown for 6 years before I opened up National Vascular Physicians. Interventional radiology is, I think, the most exciting field in medicine. This is a subspecialty where we barely make an incision on the patient, a half centimeter nick on the patient, and are able to do incredible things by using X-ray or other imaging modality to guide our treatments. And we're able to treat a lot of different disease processes through this and really have a meaningful impact on a variety of patients with a lot of different medical issues. So my favorite thing about being a doctor, aside from obviously impacting my patients' lives in a very meaningful way on a daily basis, is the ability to help really advance the care for a large number of patients. So, that's part of the reason that I like staying involved in clinical research to really identify and refine new treatments for patients, and not just the patients that I'm treating at that moment, but other patients down the line. So the goal for any of my patients really is to try to alleviate their ailment as much as humanly possible. So, a woman who comes in with uterine fibroids, or a man with arthritis, I want to be able to provide treatment to take away as much of their suffering as possible.